Hello, I'm Dr. Melissa Stiles with the University of Wisconsin Department of Family Medicine, and today is a first in a series of podcasts on leadership. Very happy to be joined by Dr. Frank Byrne, who's president of St. Mary's Hospital Medical Center. Thanks for joining me, Dr. Byrne.
Glad to be with you, Melissa. Thank you.
First, can you talk about your path? What led you into hospital administration?
I was a practicing pulmonary and critical care physician, and I had the opportunity to serve as a medical staff leader at the hospital I practiced at in Indiana. And because of some previous conflicts between the medical staff and administration, the administration and medical staff had worked more closely together and to engage physicians in their shared work with the hospital. And I was on the path where I was a medical staff officer, the chief of staff of the medical staff, and with those duties also came a board seat on the hospital board. And that really got me to thinking how my work fit into the rest of the hospital and how the hospital fit into the community. And as I was completing my 4-year term, there was an opening in administration as the medical director or vice president of medical affairs, and I was offered that position and took it. So that's the short version of how I ended up in administration.
Great. Well, backing up, you said you kind of started and there's some conflict going on.
Yes.
Can you describe what you feel are the kind of effective keys to dealing with conflict and crises? Obviously, you deal with a lot as president, hospital president.
Well, and I've seen this in the medical arena. We've been through several cycles of, I don't want to call it boom and bust, but we've been through several cycles during my career where things have been going pretty well in healthcare, and then periods of disruptive and transformational change. And the situation in the hospital I was at, which actually occurred before my arrival there was a conflict over the quality of pathology services, I believe it was, and the medical staff didn't feel that the administration was listening to them or doing anything about it. So the medical staff president went to the board chair and said, "You've got to get rid of the hospital CEO because he's not listening to us." To his credit, most CEOs, I don't care what business you're in or what industry, most CEOs go into a defensive mode at that point and go into a bunker mode, and that's the beginning of the end for everybody. To his credit, the hospital CEO engaged the physicians, formed better relationships with the medical staff leaders by having the bylaws of the hospital changed so that the medical staff officers, the 4 officers, would also be board members, and in something that was very unique at the time, they started meeting, the top 4 administrators and the 4 medical staff officers met every week for 2 hours about non-physician issues, things like capital budgets, operating budgets, new technology, staffing and things of that nature, really engaging the practicing physicians in the operations of the hospital. So to answer your question about conflict, the first step in resolving a conflict is to realize a conflict exists, and the second step is to come together, define what the issues are, and listen to each other. If you don't do those steps, you're not going to get anywhere. I will say these days I see too much of this trying to be handled by emails, serial emails, things that people could resolve if they sat down with each other for 5, 10, or 15 minutes. Instead becomes a 6-month-long, 17-entry email extravaganza chain.
Okay. One thing that really impresses me about your leadership style is that you're very people-centered, and you care about the organization, but you put people at the top, and I think that's obvious. Can you talk about what you feel the effective characteristics of a good leader are?
Well, there are several key elements. The primary job of any leader is communication. And every problem that I've either had to adjudicate or that I've caused clinically or administratively throughout my career, there's always been a root cause of communication. So step 1 is to communicate, and communication is bidirectional. It's not unidirectional. That's called a monologue. So step 1 is to be accessible and approachable so that you will have bidirectional communication. I've seen leaders, I've learned from negative role models as well as positive. I've seen leaders in the past who not only didn't like getting bad news, they punished the messenger, if you will, for delivering the bad news, and I've seen disastrous consequences. Of course, one we're all familiar with, not in healthcare, was the Space Shuttle Challenger disaster, where people knew that those O-rings were not going to work at those temperatures, but they were in a culture that didn't feel empowered to share that information. So, so as a leader, I try to be approachable, accessible, and it is amazing to me what people tell me, and I'm humbled and honored by that they feel comfortable telling me what's on their mind.
Listening is key.
Listening and communication. The other thing is preparation, especially to physicians as leaders. It's important that we get the right preparation to be a leader. We don't get the types of we still don't get great instruction on effective communication, which is the cornerstone of leadership. We don't learn a lot about organizational dynamics and organizational structure and how things work in an organization in medical school. And then we get sometimes as clinicians, physicians, nurses, we get pulled into these leadership roles without preparation, and it's tough to be successful without the preparation. So if you're going to go into a leadership role, prepare yourself properly. Get a mentor. Get appropriate training. I had a number of mentors. I've had a number of mentors and continue to have a number of mentors in my career. I also have physician leaders who are entering leadership roles that I am privileged to mentor and share what I've learned over the years.
Physicians are often looked on to be leaders in the hospital and are on many committees. And so one of the first roles you see physicians will be chairing committees. What do you see as the effective key components of running a meeting?
Well, the first thing is to have the right people in the room and have the people who can make decisions and who have the subject matter expertise. None of us is all-knowing about any issue, and so there are other resources we need. In the hospital, in a medical practice, we have business experts, we have clinical experts, and obviously within the hospital you have people who have expertise in different clinical areas. So step one is to have the right people in the room and to respect those people, to listen to those people, to have your leadership style be inclusive and not dictatorial, and hear what they have to say. And one of our Achilles heels as physicians, to be quite honest with you, is that I've seen many times throughout my career, is our unwillingness or inability to respect and trust other disciplines, accountants, lawyers, professional managers, and I've seen disastrous consequences from that, from not engaging those other professional disciplines that you need to be a successful leader. And then the other thing about a meeting is create a meeting environment that people want to come to. Create a meeting environment where people know they can make, why do we do anything? Why did we go to medical school? We want to make a difference. So if you set up whatever there's a committee or an organizational structure for your practice or for a faculty practice, if you set up a structure and processes so that people know that they will have valid input, they will have the opportunity to provide input, and their presence will make a difference, they'll come and they'll come prepared.
That sounds great. And lastly, if you could talk about, last year St. Mary's really transformed physician leadership in this institution. Can you talk about the background and what you envision will occur because of that change?
We have a great relationship with our physician partners here at St. Mary's, and we have since the hospital was founded in 1912. But what was lacking at the bedside was a way to engage the physicians who are actually providing the care at the bedside in how we do things at the hospital and in the work of the hospital. We had our quality structures were good, but they were somewhat anachronistic based on the way things were done in the 70s and 80s. And not that there wasn't good work being done, but it wasn't a structure that was going to get us to exceptional. So what we did was we literally scrapped the medical staff structure. We continue to have elected leaders of the medical staff who are board members and engaged, but we now also have the 7 part-time medical staff directors who oversee several departments clinically and spend approximately 1 day per week doing that. And it's really, the way I like to think of it is that's the vehicle by which we can engage the hearts and minds of the practicing physicians at the bedside in the work we do and how we do the work and why we do the work.
Mm-hmm.
So the outcome we're looking for is similar to a case study I wrote about my own experience as a physician leader, about how we engage the practicing physicians through involvement in governance and the operational leadership of the hospital. That hospital, by the way, went from third to first in the marketplace when they transformed their relationship with the physicians.
Mm-hmm.
And they also went from good to great in things like patient satisfaction and clinical outcomes and financial outcomes. Not an accident.
And for physicians that are wanting to get into leadership positions within hospital administration, short of going through a degree program and going on, what resources would you guide them towards?
There are a number of resources. And I would first say, Melissa, that I hope that physicians will aspire to leadership roles in healthcare, and not just roles like mine as president of a hospital, but whether it's a medical staff or department or even within your practice. We bring great passion for our work. Why did we go to medical school? Again, to make a difference in people's lives. Of course, my mother, when I went to administration, I was afraid she was going to say, "So, you went to medical school for nothing?" No, Mom, I'm trying to leverage what I learned in medical school more broadly. And that's what we can do in leadership roles. We can take what we've learned by treating one patient at a time and leverage that on behalf of populations, which is where the future is population health, community health, and improving the health of our communities. One patient at a time is still the most meaningful thing I've ever done in my career, by the way, and I miss direct patient care only every day, many times, all day.
But the work you're doing is invaluable. Well, thank you very much for joining us today.
It's a pleasure, Melissa, and thank you for your leadership as well. It's a privilege for me to be part of your work and part of the great work of the University of Wisconsin Department of Family Medicine.